Is a long-acting lipoglycopeptide an effective treatment for complicated Staph aureus Bacteremia? Does telemedicine improve access to abortion medications? The latest on preventing and managing measles and much more on today's JAMA Editor Summary. Hello, and welcome to our listeners around the world. Today is Friday, August 15th, 2025, and I'm Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief of JAMA and the JAMA Network. For this episode, I'm joined by JAMA Deputy Editor, Dr. Preeti Malani. Hello, Preeti. Let's get started with the DOTS trial.
Hi, Kirsten. The DOTS trial is a randomized clinical trial by Dr. Turner and colleagues. The investigators evaluated the efficacy and safety of Dalbavancin versus standard therapy for the completion of treatment of complicated Staph aureus Bacteremia. Participants were randomly assigned to receive either 2 doses of intravenous Dalbavancin on days 1 and 8, or 4 to 8 weeks of standard intravenous antibiotic therapy. The primary outcome was the desirability of outcome ranking, DOR, at day 70, which involved 5 components, including clinical success, complications, mortality, and quality of life. The authors reported that Dalbavancin was not superior to standard therapy in this study, but they add that when considered with other efficacy and safety outcomes, these findings may help inform the use of Dalbavancin in clinical practice.
Preeti, you and Dr. McCreary wrote the editorial that accompanied this trial. You note that the work of Turner and colleagues offers a practical roadmap for where Dalbavancin should and should not be positioned clinically, connecting the dots and prompting a broader dialogue about novel approaches for treating Staph aureus Bacteremia.
I had a great time discussing this with the trial's senior author, Dr. Holland, on the JAMA Author Interviews podcast. Here's a bit from Dr. Holland on why he and his colleagues decided to conduct this trial.
First and foremost, we need better treatments that are safe. And because Staph aureus has the tendency to persist and to relapse after the completion of treatment, our conventional approach for these infections is a fairly long course of intravenous antibiotics, the 2 weeks at a minimum, but more commonly 4 or 6 or even 8 weeks of intravenous therapy to try to eradicate these infections. And in fact, most patients are clinically well, or at least clinically stable, long before they finish these prolonged courses. So most patients are leaving the hospital with a PICC line or a central line in their arm that they can continue to give intravenous antibiotics either at home or sometimes have to go to a nursing facility to receive those. So it's really appealing if we could have a safe and effective alternative to that, first and foremost. I think a second reason that we wanted to do this trial is that through the Antibacterial Resistance Leadership Group, or the ARLG, which is an NIH-sponsored group that tackles antimicrobial resistance, we had the right site network and the right enthusiastic investigators to take on this trial. We felt like it was one we should do. And then I think a third reason is that the antibiotic Dalbavancin is promising, but untested for this indication. It has data on efficacy and safety in skin infections, but that's not really the area of greatest need. I think clinicians are most interested in using this antibiotic for these deep-seated, often Staph aureus infections. And actually, this data has been published in JAMA Network Open that looked at current use of the long-acting lipoglycopeptide, so Dalbavancin and a related antibiotic called Eridavancin, and showed that clinicians are using these for deep-seated infections, usually with Staph aureus. So there's interest in using these antibiotics, but we don't have high-quality data to inform that use.
Moving on to research letters that JAMA published this week, Dr. Aiken and colleagues report on medications used for abortion that were prescribed using asynchronous telemedicine. The authors analyzed 15 months of data from Aid Access, a telemedicine service, and found that Aid Access provided more than 100,000 medication abortion pill packs during the study period, 84% of which were in states with near-total abortion bans or telemedicine abortion bans.
Yes, and Dr. Huberfeld and colleagues wrote an accompanying editorial. They provide some helpful health policy background on interstate shield laws. They also highlight the importance of telemedicine for patients living in states with abortion bans, for patients with low income, and for those residing in rural areas.
Another JAMA research letter this week focuses on how international medical graduates and U.S. medical graduates contribute to the U.S. medical workforce. Dr. Haylott and colleagues used a retrospective serial cross-sectional study to analyze a county-level physician count from 2010 to 2022. They report that the proportion of international medical graduates was relatively consistent during the study period, and they note that international medical graduates had a larger role in urban counties with medically underserved areas, while U.S. medical graduates had a larger role in rural counties.
JAMA also published an interesting preliminary communication with Dr. Orbach and colleagues. Vein of Galen malformation is the most common congenital cerebrovascular anomaly that has devastating outcomes. The authors report their results from a single-center, single-group intervention study evaluating the feasibility of in utero embolization of fetal vascular abnormalities.
It's time to turn to the JAMA Viewpoints. Dr. Robinson provides an update on tariffs, drug manufacturing, and innovation policy. Readers can learn more about the economic interplay among these areas and how they could affect key pharmaceutical subsectors.
In another JAMA Viewpoint, Dr. White and colleagues discuss family planning providers. This is timely given the recent U.S. Supreme Court decision denying Medicaid enrollees the right to choose a qualified family planning provider and the reduced access to reproductive health care.
Let's discuss the clinical content from JAMA this week. First up, Dr. Borgert and colleagues wrote a review on prostatitis, a condition that affects over 9% of men during their lifetime. The authors summarize current evidence on the evaluation and management of acute and chronic bacterial prostatitis, as well as chronic prostatitis and chronic pelvic pain syndrome. Tune in to hear a conversation between JAMA Deputy Editor Dr. Mary McDermott and corresponding author Dr. Pham. Let's listen to a bit of Dr. Pham talking about the 4 categories of prostatitis.
So prostatitis refers to infection or inflammation or discomfort that is attributed to the prostate. There's actually 4 categories of prostatitis that's defined by the National Institutes of Health, but 3 are what are most commonly found clinically, and that's the focus of our review. So type 1 is acute bacterial prostatitis. Type 2 is chronic bacterial prostatitis. Type 3 is chronic prostatitis, chronic pelvic pain syndrome. These first 3 are what are commonly encountered clinically. The 4th is asymptomatic inflammatory prostatitis, which is found incidentally during the evaluation of other issues like for cancer and doesn't require further evaluation or treatment.
For this week's JAMA Clinical Challenge, diagnose a 34-year-old woman who has recurrent strokes and bilateral narrowing of the terminal portion of the intracranial carotid arteries, more severe on the right. You can read the full history and review the MRI images to figure out what to do next. There is also an accompanying JAMA video in which you can see the imaging that identifies a carotid artery blockage in a brain associated with this condition.
Access to mental health care for physicians is such an important topic. Dr. Sadaway Konevka and colleagues provide more information on mental health challenges for physicians and potential barriers to seeking help. They also create an outline for a multi-level intervention approach. And next, our patient page this week is all about cataracts. This article guides readers through basic eye anatomy, diagnosis, and surgical treatments.
Measles vaccinations have been declining in the U.S. A new JAMA Insights by Dr. Stoneman discusses presentation, management, and prevention of this highly contagious infection.
Don't forget, you can keep up with the latest articles in clinical medicine, biomedical research, public health, and health policy written and researched by our outstanding JAMA Medical News team at jamamedicalnews.com, or you can click on the link in the show notes.
Thanks, Preeti, and thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Kirsten Bibbins-Domingo. This episode was produced by Shelley Steffens and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.